So the Heart Foundation, we've been around for 47 years this year. And the bottom line is that all our efforts are to promote heart health in Jamaica, to reduce cardiovascular disease, and to work in any of the risk factors, whether it is unhealthy nutrition, or it is reducing high blood pressure, tobacco control, and so on. And the World Health Organization goal, as we know, is to reduce premature mortality by 25% by 2025. Now, as we had said earlier, we're all going to go one day, but we want to go when our time has expired based on, our normal lifespan, and we don't want to be incapacitated meanwhile. The Heart Foundation is a member of the World Heart Federation, and those goals, we have taken them and worked them out in terms of those relevant to cardiovascular disease. And if you notice on the far side, it says diabetes and obesity. Our goal is to have 0% increase. So even the drive that we're having now, we would be happy, not comfortable, but we would be happy if at least we had no continued increase in obesity, and then we started to see a reduction. And of course, we can go back, please. And of course, harmful use of alcohol is also another concern. I see the National Council on Drug Abuse have campaigns about that, and I'm sure in due course that will become more topical. Physical inactivity, we want to reduce that by 10%, and the Jamaica Moves campaign is very well placed for that. And we heard from Suzanne about the sodium intake, and tobacco use we know is all harmful for health. So these are all the various risk factors that if we work on them, we can achieve our WHO target. And these are the global figures. 4 in 5 cardiovascular deaths are from heart attacks and strokes. And as you heard, the national figures, you have heard these before, and the top one jumps at us with over half our population being overweight and obese. And so we have many services, but they're in different areas. We have screening, we have advanced cardiac services. So when we find that there is a problem, we then carry on to the next step. Because having screened people, sometimes people may need those services, and you can avail them at the Heart Foundation. We have health education and training, and health promotion and advocacy, which is activities such as we have with the sugar sweetened beverage campaign. And we have medical services. We have a pharmacy with reduced medication. The prices are reduced. Biomedical lab has a concession there. We teach emergency cardiac care. Tobacco control is one of our main flagships. We're the Secretariat for the Jamaica Coalition for Tobacco Control. We have a school health education program, and now the obesity prevention campaign. Our services are available island-wide. We have mobile teams that go around Jamaica, not just the screening, but also to do CPR training. You may have seen us in many supermarkets across the corporate area, Kingston, St. Catherine, Portmore, we're there in some of the main malls there. We have various clinics at the Heart Foundation. We also screen for athletes for the risk for sudden cardiac arrest. We know that that was very topical some time ago, and in fact last year, Heart Month, we focused on that. We also have cardiologists, they do cardiac consults and also pacemaker evaluation, etc. And for the various risk factors, we have nutritionists, and we also have a home visiting service. I need to stress that because many times we see people struggling to come to the Heart Foundation in taxis and wheelchairs. We will actually come to the person's home and carry out these tests. That's the services again. Next. Just to let you know in terms of our figures here, in terms of blood pressure, 21% of the persons that we saw were normal, which means that the rest were problematic. Right, so stage 1 and stage 2 hypertension, that's what we really need to look at. 30% and 14%, because those are the categories that need treatment. Let me explain that unlike the Jamaica Health and Lifestyle Survey, which is a scientific conducted survey, the persons that come to the Heart Foundation of Jamaica are self-selecting, so they just turn up. So the figures here can't be representative of the national sample. And also when we do these tests and we find readings that are abnormal, they're then sent back to their doctor or to the clinic at the Heart Foundation for them to determine whether the persons whether they need further treatment or what the situation is. So these results are only based on the readings that we found at the time. So as I said, so 44% of the persons at that time were found to have stage 1 and 2 hypertension, which would require treatment if this was confirmed by their doctor. And remember earlier we had said that the target for the World Health Organization, WHO, was to reduce raised blood pressure by 25% in all our populations. We do ECG tests, as you know, and about roughly half were normal and half were abnormal. Over the people that came, it's interesting to note that a lot of the men were abnormal. That's interesting because the people who come to get screened are always 70% women and 30% men. I believe that's the same in the ministry, Dr. Davison, the gender, in terms of who seek health care. So 70-30. So even though most of the people that come are women, the abnormal ECGs for the men, which of course were then sent back to their doctor, were higher than the women. And the cholesterol that we found, so most persons actually had, their cholesterol was okay, 71%, and high risk were just 10%, and there was more females than males that had high cholesterol. Blood sugar, about 6% of the persons we screened had high blood sugar. And HbA1c, so this is a measure of glucose control over a period of time, and about 83% of those that we saw were abnormal, bearing in mind that, again, this is a self-selecting population. And of course, persons who know they have a problem would probably be more likely to come and be screened. Next. Body mass index, well, we're not doing too good with the patients that we see either. We only had 30% that were normal. And if you have a look at the figures here, we have overweight 32%, 21% obese 1, class 1, obese class 2 was 8% and 4. So you can, if you add that all together, you can see that our figures actually mirror the national figures. We have a great problem with this. On our mobile teams, we have to carry portable scales because the tall one, you know, which that you see in doctors' offices, can't go on the mobile team. And unfortunately, these portable scales go to 350 or 400 pounds sometimes. And sometimes our scales get broken because the people are heavier than the amount. And so Ms. Philpott Brown, our manager here, is constantly buying scales just to show you the extent of the problem that we have and a practical example of the situation that we face, because the staff sometimes have a hard time judging, do you put them on the scale, don't you put them on the scale, but it ends up breaking. So I don't know if as time goes along, the manufacturers will make scales that maybe go up to 500, but it just shows you that we're just accommodating, it just keeps going, you know? So that is a big concern to us, to show you the extent of the problem. Our blood pressure cuff sometimes can't fit the patients. We have to get extra large cuffs so that we can screen everybody appropriately, because it's not one cuff fits all. You have different sizes. So these are just some little practical examples. Our chairs in our waiting area, they can't accommodate, 400 pounds. And so when you buy chairs that are sturdy, sometimes you'd think that a chair is okay, but you really have to be doing more checks. So these are some of the issues that health facilities, I'm sure the ministry has the same problems that we face. Waist circumference, increase waist circumference around your tummy button. That is a risk factor for cardiovascular disease. And as you can see here, just over half that the persons that we saw had a wider waist than they should, and the women were far more. Men were 25% and women were 65%. So it's just an extension of the same problem of the increased body mass index. And as you see, go back one, the 0% increase is the target that we're aiming for in the first instance, and then of course we want to see a decline. We're hoping that our campaign, sugary sweetened beverages, will help with this. It will take a while, but hopefully we can make a dent. Next. All right, for Heart Month, you won't remember all these, but just to say that we're in a lot of health centers during Heart Month. We go all year long, but we have quite a few health centers here that we would be visiting, and we'll be putting it on the radio, and we encourage the public to come out, and we'll be going out of town as well. I know there are some dates that are not here yet because we're confirming dates in other parishes. I told you about CPR training. Please try and get trained in CPR. Next, and first aid. We have CPR training at the Heart Foundation regularly. Doctors and nurses, their routine classes, laypersons can book classes. And remember that we're also the first aid training. If somebody collapsed in your office or workplace today when you went back, what would you do? Would you know how to save them? Could you do something until the ambulance came or until you got the person to hospital? Sudden cardiac arrest, we have screening for athletes or anybody who wants to check if they're going to be doing increased exercise in particular, they can come and be screened at the Heart Foundation. And we have many teams that come through, especially when certain championships are coming up to be screened. And whereas it's not 100% foolproof, it certainly would reduce the risk if the person was screened and we could identify any potential problems. We can bring in automated external defibrillators. These are the machines that shock your heart to get it back into its normal rhythm. But nowadays, they make machines that are lay-friendly. It's not like years ago when, you had to be specially trained, a doctor or a senior nurse in a hospital. So these are lay-friendly. And if your organization doesn't have one, especially if you have a lot of foot traffic, then we would encourage you. And the course that we do trains you how to use them. So they're available through the Heart Foundation. And these are just some more training dates that we have. Whether you want advanced courses if you're a doctor or a nurse, or first aid, please contact us and we can put you on our next course. For Heart Month, our CPR day, and this is for lay people on the 24th of February. It's just $1,500. You can just turn up for one day and do a course, get your certificate, and you'll be taught how to save a life. This is Heart Month, but we mark several occasions throughout the year that cover all the risk factors for cardiac disease. You heard about SALT from Suzanne. That's coming up next in March. There's World Physical Activity Day. Usually we participate with the Ministry of Health. Go Red for Women campaign, focusing on women and heart disease. World Hypertension Day, World No Tobacco Day, CPR Week, World Heart Day, Alcohol Reduction Day, and Pharmacy Week. And we use each of these opportunities to be able to inform the public. This is World Salt Awareness Week that's coming up the second week in March. And you heard about how much our salt should be. And alcohol in excess is an issue. Next. We also have a membership program at the Heart Foundation. Next. For $1,500, persons can be members and get discounts. And we have many other forms of communication, all the social media and so on. We have a schools program in several schools next, and we try to get to the children at an early age, teach them about healthy lifestyles. Right? And of course, we are very happy to support the Ministry of Health Jamaica Moves program, which we think is excellent. And you heard from Dr. Davidson about the National Food Industry Task Force, which the Heart Foundation of Jamaica is a part of. And you heard about the areas of their focus. So with success, the task force will have addressed many of the areas that are of concern today, and especially food labeling, which is our theme for the month. And you heard about our campaign. And next, and you heard about the figures in obesity. I won't go over them again. Next. And we do have for the doctors, we do have a medical symposium coming up at the end of February for those who, those professions, and we do give continuing medical hours for it. And usually GPs attend in particular and get updated on aspects related to cardiovascular disease. And these are just some of the agencies that we focus with. Right, and I'd really like to thank the media for your support, because without you being here today, we would just be talking to each other and we wouldn't get the message out. And just before I close, in one day, let us say yesterday, when you drank from you got up in the morning till you went to bed at night, how much liquid do you think you drank? Not necessarily of any type, just anything, coffee, tea, water, juice. Usually I would say most of us would drink at least this quantity, whatever it was. Would you say? Or maybe more? Not enough? Not so much? More? Less? But I'm thinking 2 liters, all told, right? But if every single time that you drank, you had a sugary sweetened beverage, then you would have had 52 teaspoons of sugar. If every single time you put a cup to your mouth, it was a sugary sweetened beverage, you will have gone 52 teaspoons. And that is the essence of the campaign that we have here, bearing in mind that the American Heart recommendation is 9 teaspoons a day for men and 6 for women, all told, including, as Suzanne told us, that these things are in other foods. It's not just the sugar by itself, but it's in other food products, especially the processed food and the small one. But if you had, so each time you have one of these, then it's approximately 17.5 teaspoons of sugar, most of the soft drinks. I have seen soft drinks, there's one in particular that has 24 teaspoons of sugar. There's some flavored waters that have 9, which is still at the high end of the men's allowance. But on average, they're about 17.5. So even one drink is over their allowance for the day. And then we have the box drinks. Anybody want to guess how many teaspoons in this? 14. 14 teaspoons of sugar every time you take up a box drink. And remember, the kids are drinking this more than the adults, I would guess, in the schools. And you heard earlier Dr. Davison speaking with alarm about the obesity figures in Jamaica. And this is what we're up against. So this has 14 teaspoons. And the child may drink more than one a day, and one is way over the adult daily allowance, let alone the child. Remember, we said 6 teaspoons for ladies and 9 for men. In total, not just this. Maybe a half teaspoon in the slice of bread this morning. Maybe you had a tin of corn and that had another few grams of sugar and so on. You may have had a yogurt at lunchtime, and it all adds up. And then just one last sample. This here, these little Tetra packs, they have about 5 teaspoons. Okay, 5 teaspoons. So when the children have these as well, it says cherry juice, but usually the only juice is the word. Just remember that the only juice is the word on it or the picture. So we cannot get taken in. So this is a challenge we face. This is the real challenge we face. Sugary sweetened beverages are a big concern. Other food kind is a big concern. The misleading labels that lead you to believe that something is healthy and it's not. But as you see, we're now at a crisis point. Obesity is at epidemic proportions, and we just have to work with our partners, the Ministry of Health and other agencies, to try and get the message out. And we really appreciate the support we have been getting from the media in recent times. So just before I close, does anybody have any questions? Any questions on labels or on nutrition or on food? What to eat, what not to eat?
Have we ever explored how much sugar is in the bag juices that are distributed in the schools?
Susan, you want to
Because
take that?
like sports day is coming up at my daughter's school for Friday, and one of the things that they asked me to buy is 6 bags of bag juice.
Not you. Not you.
So have we ever explored that?
Just because most of them might be from home operations, most of them are made just from syrups and water, no fruit juice in there. And also, because it's not regulated and there's no prescription or method as to how you should reformulate it, they can vary in sweetness and how much sugar is in there. And because it's so common and it's sold all over, it's one of the cheapest beverages per unit volume that is out there. And yes, it's very easy. It doesn't require a lot of packaging, and many people make it. So we don't really know a lot of the facts about them and how it's reformulated, but we know it's all empty calories for the most part. So we're hoping that we'll be able to do some research on that.
I know we have talked a lot about bag juice, but there's also bag water as well. So we should also think about that and encourage that as well, which is also cheap, which is also easily accessible. There's bagged water as well.
Yes, and I most definitely endorse that. We tend to only see it when we have these marathons and races. Sometimes it's a little sweet. For some of them are sweetened, but you can encourage that. Because in that instance, most people actually want it because it's frozen and it's cold and it's very good on a hot day. So yes, I would actually encourage you, and it's available. So you just need to ask them to give you the water instead.
I'd just like to say something. I don't want us to go away with the impression that all sugar is bad.
Right.
Sugar is something that's required for energy, and there may be situations where you want or need to give a participant in a race or in some physical activity glucose to, bolster their energy levels, and that may be required. But certainly for the purposes of rehydration, at sports day, I don't think you should be buying sacks of bag juice for your children. We would not support that.
Any other questions?
Morning. How do you propose managing, a lot of people, like for lunch, they go to a cook shop where you see a lot of rice, maybe not so much meat, but a lot of gravy, that kind of thing. How are we going to manage that?
All right, so as I said, you do have foods out there. There are healthy options out there, You want to go for the foods that are more in their natural forms as opposed to the processed forms. One of the things you can start doing just off the bat is actually manage your portions. So most of the box lunches out there are just, the portions are just too much. And earlier, when was it, last week, that I had mentioned that typical box lunch, that square styrofoam container, can easily have 5 to 6 cups of rice. And that's what you need in a day. So one of the first things you can do is actually just cut it in half. Just cut the amount that you have. But as I said, if you don't do it from the beginning, because for most people, even though you are presented with much more, research shows that you will still eat all of it if it's there. So the first thing before you even start, buy a smaller serving or cut what you are eating and put it away and maybe have it at another meal. And from a budget standpoint, it can help you because then one meal can last for maybe 2 or 3 meals, or you can share it. And there are many things, and let me speak for, I know there are at least 2 nutritionists in here, because we were just saying that many people don't consult a nutritionist or a dietitian, where we can go through your diet in extensive detail and tell you where the bad foods are. But you do want to look for the healthier foods, cut down on fats and oils. So instead of fried foods and gravy, go for baked, broiled. And instead of the refined, high sodium foods, go for the things that are more in their natural state, not so heavily processed. And that's a start.
I just want to mention on that note that the school nutrition policy is being worked on now with the Ministry of Education in collaboration with the Ministry of Health. And we really look forward to that coming to fruition because that will provide some guidelines and some policies for what can be sold in schools and what cannot. Of course, the enforcement will be another matter. But certainly I think that it's a step in the right direction and we're hoping that for the new school year that will be in place.
You go and buy lunch and you ask for extra vegetables and it's a problem to the people who serve it. They don't want to give you extra vegetables. You might say, give me, I don't know, whatever, a little rice or whatever and more veg and it becomes a problem. Right.
And well, my only suggestion there is that they change where you buy your food. And you either, a lot of when we eating healthy is about preparation. So if you know that wherever it is that you're going to eat your lunch, then you can carry your fruits and vegetables to work and have it there. You can also encourage whether you're the cafeteria that you work at or you eat at or the restaurant to make that change. There are restaurants out there that offer a lot of vegetables. And when we speak about vegetables, it doesn't mean that you need to eat 4 or 5 cups of vegetable plate in one day. That's what you need for the day. Even if you can get half cup to a cup at each meal that you have, that's of benefit. But about healthy eating, a lot of it is about preparation. So you can carry your things from home.
All right, I'd just like to close by playing our ad.
Does this look familiar? There's the breakfast fruit drink, the long ride to work energizer, the mid-morning quencher, and the sodas at dinner time. But that many sugary drinks a day add up to more than 50 teaspoons and could bring on obesity, which could lead to type 2 diabetes, heart disease, and even some cancers. Are you drinking yourself sick? Drink water instead. A message from the Heart Foundation of Jamaica, the Ministry of Health, Jamaica Moves.